Keeping health first, Novant Health, the New Hanover Regional Medical Center, recently recognized with the American College of Cardiology Platinum Performance Achievement Award. It's a national honor that highlights excellence in treating heart attack patients. And joining us to explain what that recognition means and what steps you can take to protect your health is Dr. Frederick Meine. Thank you so much for coming in. I appreciate it.
Thanks, Kim.
That award is great. It's a mouthful.
And
let's just kind of break it down for, you, me, other families in our area, and what that means. If I have a family member and I'm worried about their heart, they're having a heart attack, what does that mean? What are they going to get here locally?
Sure, so that's a great question. What we're most proud about this is the highest award that the American College of Cardiology gives for heart attack care. It's about 300 hospitals in the entire country that are awarded platinum status, and it's a measure of how our community and our hospital treats heart attack patients from the minute they start having chest pain through the remainder of their course for the rest of their lives. So it measures how rapidly we're able to treat their heart attack, how well we treat them with the correct medicines and procedures, and then how well we treat them after their heart attack to make sure they have a full recovery and get back to a normal life.
So it's equipment, it's people, and it's programs.
That's absolutely right. The most important part of it, or probably the most notable part of it, is how rapidly we can get people heart attacks with their artery open. There's a national guideline that within 90 minutes of the time that a first medical provider meets you with your heart attack, whether that's an EMT, or if you walk in the emergency room, can we have the artery open and have normal flow back to your heart? And the goal is 90 minutes, and we meet that the vast majority of the time. And it's a really difficult thing to do, and it requires an entire community of providers, EMTs, ERs, physicians, cath lab staff. So that's part of it, but it's also taking care of the patient after that and making sure they get full recovery. Their
nutrition, I think their exercise. I've seen some of those programs as well as other things that I've done here, reporting, of course, at the station. Great information, and of course the goal to keep people local so they don't have to go somewhere else.
Absolutely.
So that's one of the other attributes here?
Yeah, so like I said, we're one of about 300 hospitals in the country that receive this award. We are very comfortable and our goal, as you said, is to keep our patients here in the community and make sure that when you do have a heart attack, which we don't want, but when you do have a heart attack, that there's no reason that you should be anywhere else but here getting care taken of you.
And just for everybody, who is watching today, reminder of exactly what to look for. I know we talk about it a lot, but I think sometimes when you're in that moment, you really are going, what do I do? Is this what's happening?
And that's actually the hardest part for us. It's really easy when you have an elephant sitting on your chest and you're short of breath and you have classic symptoms to know that you need to call 911. Unfortunately, that's not always what happens, and that's probably the minority of time. So what we always tell people, look, if you're not feeling right, if you don't feel like you should, if something's going on, it can be the classic symptoms like elephant on your chest, crushing substernal chest pain, shortness of breath, but it can be really atypical symptoms as well. Jaw pain, cold sweats, nausea, dizziness, shortness of breath. Any of those things, what I always tell my patients is if you don't feel right, I worry about it. And it doesn't mean it's your heart. It could be heat stroke or something else like Gannon's been talking about, but yeah, we worry about
anything that you're kind of overexerting yourself can lead to that as well. And I know the symptoms for women and men are different. We don't have time to talk about that right now, unfortunately, but I just put it out there. So definitely make sure you know those differences as well. And thank you so much for coming in and joining us today.
Absolutely. Thanks for having me, Kim.